Hello, my name is Cecilia Akatukwasa, and I'm a public health specialist with a special inclination towards the social and behavior sciences, doing research in HIV/AIDS, other infectious diseases like TB, and I've also done a lot of research on sexual and reproductive health issues of adolescents. I currently work at the Infectious Diseases Research Collaboration in Kampala, Uganda. I would like to talk about my project today, which is conceptualizing community pathways for community mobilization approaches to strengthen support for school retention and promoting sexual and reproductive health outcomes for adolescent girls. We know that adolescents face a number of challenges that are multifaceted, and these include education challenges surrounding poor school retention in school. Adolescents face a lot of mental health challenges. They face a lot of social challenges that are mainly, especially related to gender norms and gender equity. And then they also face a lot of sexual and reproductive health challenges, including pregnancy, a lot of HIV/AIDS infections, sexual violence, and other many challenges. So we would like to know, what do we need to know? That if we did community mobilization, amid these previous interventions that have been done for adolescent girls, we want to see, does it better school retention and then positive SRH outcomes for adolescents? Because we know that community mobilization has a lot of benefits. There's the adolescent social networks exist within their communities. The resources that enable them to thrive exist within the communities. The support networks exist within the communities. So if mobilized around these key areas and other areas, are we able to leverage on these and obtain good retention in school and thus good SRH outcomes for adolescent girls? Yes, this is possible because there has been evidence in literature. And we know that community-based initiatives engaging adolescents, their caregivers, and key stakeholders to advocate for bidirectional linkages between schools and communities have been tested in several studies, in several projects, and have been shown to work with multiple interventions. So we want to do a comprehensive examination of the different pathways that different projects have used to address the school retention issue and overall SRH outcomes for adolescent girls. And this would, of course, provide a clear framework to inform policy formulation, program development, and then also look at grassroots interventions geared to fostering resilient and healthy adolescents. So I did literature review of 3 large-scale interventions to understand these key pathways, to understand how they obtained results as far as ensuring school retention is concerned, and thus good SRH outcomes. I did 3 large interventions. There's the SAGE intervention under the DREAMS project. There's the Close to Home project for girl groups, community-based girl groups. And then the other study was also a review of different interventions to address structural barriers to SRH, to SRH of adolescents. So in this, I examined the key issues that the intervention packages comprised and the key outcomes that they looked at, and tried to see which of these intervention options were cross-cutting and which outcomes were cross-cutting. And so I came up with 3 intervention options to wrap up the three studies and come up with 3 intervention options, that is safe schools and safe friends, economic empowerment, and comprehensive sexuality education. All these done at a community level. So here are the proposed pathways coming from these studies that I reviewed. So these studies mainly looked at SRH risks and challenges, restrictive gender norms, educational challenges, and socioeconomic challenges. So these are the key challenges they look to address. And what are the intervention options that I drew that are cross-cutting across that would generate good outcomes? Comprehensive sexuality education, economic empowerment, and safe schools. So under this, I propose that I would do under CSE, I will propose to do a training manual for community leaders and parents on SRH, conduct community engagement activities, and leverage on safe spaces for SRH information for adolescents. And then the second intervention options, economic empowerment, to leverage on existing savings groups for women and girls, and then also mobilize financial resources within communities to support girls in school. And then the third one was safe schools, creating support committees at community level to monitor education activities of adolescent girls, and then also economic support for caregivers to support girls in school. And the outcomes would be retention in school, SRH information and knowledge, adoption of protective behaviors, economic empowerment, and equitable gender norms. So this proposed pathways is a framework I would use to develop an intervention to test and see if it would generate better outcomes compared to the previous studies. So I will submit this for to a funding source for possible funding and see if I can scale this up at community level. I would like to appreciate the WomenLift health program because it has helped me awaken the leadership in me. I realize that I have the full potential to change this world as a woman, to mentor others, to lift other women, use the power I have as a leader to develop others and promote leadership at all levels, from the individual level, community, up to whichever level I can get to. Thank you all for listening.